Welcome back to the third installment of our virtual interview day overview. In this set, we're going to be talking about our clinical training here in our program. So as I mentioned briefly, clinical training formally starts in year 2 within our program. Year 1, students are doing didactic coursework in things like ethics, intervention, psychopathology, really getting ready for doing clinical work. In year 2, we throw you into the fire. We've got in-house clinical intervention practicum, which are supervised by our in-house faculty here. And so you're seeing clients in our clinic. In the fall, as I mentioned in another video, our students are seeing adults doing adult therapy. And then in the spring, students are either in a child and adolescent practicum or are in another adult practicum based off of their interests. Then in year 3, our students are doing two things. They're continuing to work in our in-house clinic, doing assessment practicum in the fall, and then in the spring doing another intervention practicum. And also they're doing what we call traineeship. So this is a 20-hour-a-week external practicum that students are doing, and we'll talk a little bit more about those traineeships. And then in year 4, it's external traineeship, and in year 5, this is optional in terms of what students are doing, because some students might be working as an instructor of record, some students might be doing research on a faculty member's grant, but many of our students are out doing an external traineeship in the community, or we do have one position within our clinic, which is our clinic doctoral associate, which you can think about as sort of the assistant director to our clinic. So one of our students each year has that role. Now, our training clinic that students work in years 2 and 3 serves community members as well as Miami students. And we have individual and couples room, there's rooms for testing, group and child therapy rooms, and we have conference rooms. It's a very state-of-the-art type of clinic. Essentially, our building was built in 2006, so compared to a lot of psychology buildings across the nation, we've got a relatively new building, so we've got a lot of really nice space to do what we need to do within the clinic. We have up-to-date electronic record keeping. We use titanium, and our technology allows us to do live or recorded supervision within the clinic itself. Our clinic is staffed by a clinic director, that's Dr. Evans Tobin, as well as a program assistant, Janie Shupi, who helped put together the interview day and who is all around the world's nicest human being. So if you ever have interactions with Janie, be sure to thank her for helping put together today's interview process. And as I mentioned, the doctoral associate staffs the clinic as well for 20 hours a week. Our clinical training inside the psychology clinic, we serve about 150 to 200 clients each year, and that averages out to roughly between 800 to 900 sessions per year. The majority of our clients tend to be Miami University students. We get overflow and long-term cases from our student counseling services, and the remaining 40% are members of the Oxford and Hamilton, which is a local city nearby, communities, as well as Southeast Indiana and some areas a little bit north of us as well, so some rural parts of town. Then our students who are out on traineeship, again, this is what we call our external practica. These are students in years 3, 4, and sometimes 5. And we have locations for these in Oxford, Indiana, and the Cincinnati area. So we're about 45-minute drive to Cincinnati, and we have some different kinds of opportunities all throughout the tri-state area. Now, what are these opportunities? So these are 20-hour-a-week opportunities, and this serves as your graduate assistantship for that time. So this is how you would be earning your stipend and your tuition waiver. And our students work in places like research hospitals, doing inpatient treatment with adolescents or adults, state hospitals, other inpatient treatment centers. We've got outpatient community mental health settings, student counseling services, school-based mental health, sometimes private practice, a lot of different opportunities. We've just recently started an integrated behavioral health opportunity, which is located within a hospital setting. So different opportunities so students can match what their training goals are. And as I mentioned, students receive their tuition waiver and stipend for most of these external traineeships. There's a few times when our students are funded by things like NSF GRFs where they're funding themselves, where students may have the opportunity to do unfunded work at places like VAs around the area. In addition, obviously, this is one thing we just want to let everybody know, that as part of these traineeships, we do background checks for our students. This is particularly important for our students working with children and adolescents. In addition to clinical placements in years 2, 3, 4, and 5, obviously our students go on their predoctoral internship. This is a requirement for all APA accredited psychology programs like our own. And we have a very good history for match in terms of our match rates for internship. So basically almost all of our students match at APA accredited internship sites, and our match rate is roughly 99% in the past 10 years. What this means is there's one student who did not match through either match 1 or match 2 that ultimately did end up with an internship that was not APA accredited at the time. And there was sort of geographical restrictions for that reason. So we have excellent match rates. Everybody matches essentially. And the reason I think that this is the case for our program in particular is that we have extensive mentoring and preparation throughout the program. So there's obviously information and advice that happens throughout time in the program, but we also have individualized methods to identify the number of sites to which students should apply, assistance with application materials and essays, practice interviews, so a lot of hands-on help to help students match on internship and go to the places that they want to get the training that they want. We've had really good success in terms of our interview yields for students who are out applying for internship. In the past 3 years, our cohorts that are applying out for internship have averaged over 10 interviews in this each cycle. Now, these, what we know from the research literature is that the number of interviews actually is the biggest thing that is associated with the likelihood of matching. And the data say that if you have at least 6 interviews, you have basically, that's the plateau on likelihood of matching. And so in that way, our students are getting way more than those 6 and then have some choices about where they might want to rank highest for where they want to go. Internships tend to be taking place in things like research hospitals, academic medical centers, state and private hospitals, VAs, and consortia. I would say that most of our students in the last 5 years have actually been applying to academic medical centers and to a lesser degree sort of student counseling centers or community mental health placements. And within that academic medical center, I would also be throwing in things like Veterans Affairs medical centers. Our students who apply to get licensed are extremely successful. So of our graduates in the last 2 to 10 years, about 85% of our alums get licensed. The reason that most people do not get licensed is either that the job that they take does not require it. So for example, perhaps they're working in a research think tank, or perhaps they're working somewhere in a different country that doesn't require licensure. Everyone who wants to get licensed has passed the EPPP, which is the national licensing exam. And you can see sort of our rate is 100% compared to the national average there. And our alums score consistently higher across content areas than the national average for even accredited programs that are out there. So our students are doing really well in terms of their long-term outcomes. What are some of those internship sites where they're landing? You can see here some of the recent internship sites students have gone to, and what you'll notice is a heavy dose of academic medical centers that include both adult-focused academic centers, VAs, and children's hospitals, and then to a lesser extent places like student counseling centers that you can see there. And I would say those are actually students from about 6 or 7 years ago that were landing at those student counseling centers. So mainly academic medical centers and community mental health settings. So that sort of talks a little bit about our internship and clinical training. And we have one more last video that I hope you'll join us for.